Hi, my name is Robert Britting, and this is my business partner, Michael Kiaga. We have spent the last several years developing an organization called the African Institute for Medical Education, or AIM for short. We are a registered, non-for-profit organization in the United States. And we're looking for your financial support. And we're hoping you will consider the value that AIM can bring not to just a few Ugandans in the cities, but in the very rural villages where information and healthcare is incredibly sporadic, if it's available at all. Tax-deductible donations can be all at one time or by making a monthly commitment. So whatever you or your organization can afford will be appreciated. All donors will be listed on our website and recognized for their contributions. And now a little bit about AIM. AIM brings state-of-the-art medical education to medical professionals at all levels in remote villages, and that same information is redesigned to teach patients and even orphan children when appropriate. The topic was Ebola, and the education and testing was in 3 remote villages in Uganda. In an unbiased, self-reported study of the participants, 97% reported that the Ebola program was very helpful. That's 9 or 10, the best marks they could give.
50% of the medical professionals, people who have already been taught about Ebola, did not know to whom they should go if they suspected an outbreak of Ebola. And 48% did not know how to protect themselves from an outbreak of Ebola. 31% did not know not to touch bats or non-human primates, monkeys, or their blood or fluids, nor did they know not to eat raw meat from these animals. In addition, 44% did not know which hospital specialized in treating Ebola. And finally, 89% did not have contact information for individuals if they suspected an outbreak of Ebola.
AIM was responsible for developing the program and evaluated the results and distributed credits to deserving participants. The education program consisted of medical education program development, testing, score sheets, grading keys, the actual grading, accreditation, the accreditation award development, reminder posters for nurses, and education materials for patients to take home so they can share them with their families and friends in highly remote areas of the country. Dr. Bernard Kiwanuga is the AIM Program Director, and he's an advisor to AIM. He's the president of the Private Medical and Dental Practitioners Council, a board member of the East African Healthcare Federation, among other recognized positions in Uganda, and he's also the Minister of Health for Buganda, a monarchy in Uganda representing 9 to 10 million people. He's responsible for reviewing and approving the materials and oversaw the Ebola program, including the training and overseeing and testing. According to His Excellency Perezi Kumanawari, a former ambassador to the United States and an advisor for AIM to Uganda, rural medical professionals in villages are remote and do not benefit from most of the programs developed by visiting countries. It just never makes it to them. AIM is an independent institution. We accept no government money from the country in which we provide medical education. At some point in the near future, we're looking to connect with companies and organizations to come to AIM when they have a program and allow us to disseminate their programs through our organization using automobiles and driving places where computers are not available. At some point in the future, webcasting and mobile will be used as well. In this next program, we are developing not 1, but 2 programs for the price of 1. Maternal health and well-being covering malnutrition and mommy and baby care. And the Ebola program will be developed so that even the more than 200 orphan children can understand it. In closing, and according to Dr. Kiwanuga, AIM will change the entire healthcare system in that country. We need your help. They need your help. And thank you for taking the time to listen.